Hi, welcome to EDSC 541. I am Professor Bobo, and I will be your professor for the next 8 weeks. This is week 1, and we should be meeting online together for our first time this time. However, due to a family emergency, I'm unable to attend. So I have this short video to give you directions for what I'd like you to do during this time that you set aside to meet me. First, I would like you to begin with your discussion board for week 1. Your discussion board for week 1 is to write it is an icebreaker, and in this icebreaker, you're going to be describing where you work and your current position, describe one or more of your personal interests and hobbies, and describe your concerns regarding mental health support at your school site, at yours or within your district, or any personal experience that you also may have had. As we know, mental health is very important, and there's lots of changes that are going on with mental health. The second thing is I'd like you to meet. I have already placed you in groups for your group assignment, and I would like you to take this time to interact with your partners that you will be doing your role play with. I have sent out that information to you, so I'd like you to take time to do that today. At least you guys can meet, and at the very least, go ahead and make a plan to meet with one another at another time. The last thing that I'm going to do is kind of go over chapters 1 and 2 and the key important informations about chapters 1 and 2. And this is something that we would have discussed as a group and done a case study together. I'm not going to give you a case study to work on because you have enough things to do to get yourself started right now. So what I'd like you to do is just do those first 2 things, your discussion board, take a look at your first assignment, begin working on your first assignment, which is due week 2. And then also start reading your chapters 1 and 2, and getting yourself prepared for our next meeting, which will be week 3. So a little bit about abnormality. So there's really just no general consensus on the definition of abnormality. So, and there are some clear indicators of abnormality. Some clear indicators of abnormality are like subjective distress, maladaptiveness, statistical deviancy, violations to the standards of society, social discomfort, irrationality and unpredictability, and dangerousness. Some points to remember about the word and indicators for abnormality is there's no one element that is sufficient to define or determine abnormality. And culture plays a huge role in determining what is and what is not abnormal. So we'll be using the DSM-5 throughout this course, and the DSM-5 is where we have these different disorders and the symptoms that they have, to how many symptoms, how many indicators you need in order to qualify for that specific disorder. Now, what's interesting is that school counselors do not diagnose these things. MFTs do, clinical counselors do, and school psychologists do. However, school counselors do not. But we do need to become familiar with the DSM-5. So the DSM-5 is where we find these diagnoses. And then with those symptoms, we're able to help our students adapt to our environment in school. So maybe our role as a school counselor would first be to we start to see signs of and symptoms of a particular disorder. Again, we would not be the one to diagnose it, but we would be the one to refer out so that the student and the family can get additional support for different things that we are seeing. We would not make any type of suggestions like this person is showing signs of, we can say words like autistic-like characteristics. We can say ADHD-like behavior. So that would be something that as school counselors, we would want to impress upon the family to go and get that specific diagnosis. So the DSM-5 is it describes mental health disorders, and it is biological, psychological, or development dysfunctions in an individual. And it's clinically significant disturbance in behavior and emotional regulations of cognitive functions. And it's also associated with distress and disability. So the DSM is a classification, the DSM-5 is a classification of these particular types of mental health disorders. And the classification symptoms help us to determine whether the person is showing those particular signs. So by having this classifications book, we're able to help individuals find treatment for those particular disorders. So, you know, how common are mental health disorders? That question is interesting because it's a significant question for many reasons. Planning, establishing, and funding mental health services for specific disorders and providing clues to the causes of mental health disorders are some of the things that we have to take into consideration when we're thinking about that. We also have to see the treatments, and that not all treatments are available for all people. The vast majority of treatment is done in an outpatient basis, and that inpatient hospitalization typically is in a psychiatric unit, and those are sometimes very difficult to find. The mental health professionals use the DSM-5 to diagnose and assess people who are showing or presenting those particular signs. So the importance of the mental health professional is to gather comprehensive evaluation of the patient and the data. And also there are different roles that each mental health professional may take, okay? So I mentioned a couple of roles already. The MFT, the marriage and family therapist. We have the psychiatrist, the psychologist. Those are all different mental health, and we have a clinical counselor. And those are all just a few of the mental health professionals. A couple of other things that chapter 2 talked about was what were the different emergence of the abnormal behavior. So the biological discoveries included the development of mental health disorders of classification systems, the emergence of psychological causation views, and the experimental psychological research and development of those particular disorders. So the book goes into the different psychological, biological, and psychosocial disorders, processes that were developed over time, okay? So those are the main highlights from chapters 1 and 2. So I would like you to, again, use the rest of this time, 1, to do your discussion board, 2, to meet with your partner for your group assignment that will be due week 5, and 3, to begin your assignment that is due week 2. Thank you so much for your patience and understanding. I hope this video was short enough, but enough information to get to know me and my expectations. I will be sending out announcements. I will also contact you via phone just to check in with you this week. Make sure everything is going as expected, since I won't be able to see you all live online. So please do expect a phone call. If you're unable to take my phone call, I'm just leaving a message to check in with you. If you have questions or concerns, feel free to contact me back. If not, you can leave a text message letting me know that you received my message and that all is well. Thank you so much and have a nice evening.